welcome back, listeners, to another interesting conversation on the Mindful Living podcast. I'm your host, Sana, and as you know, this is the space where we dive into the intersection of science and soul, and we explore how mindful living can shape the quality of our lives. Now, listeners, today's conversation it asks us to look at the Western medicine through a different lens, one that doesn't stop at the physical but considers the non physical dimensions of being as part of the healing process. And listeners, let me introduce my guest to all of you, Julius Torelli. He has spent over 4 decades practicing medicine, and he has seen firsthand how symptoms often present with no clear or ambiguous physical findings. And these medically unexplained symptoms, like chronic headaches or IBS, irritable bowel syndrome, can be incredibly debilitating. Yet, they're often treated only at the surface level. And through his Gratefully Well model, Julius blends neuroscience and emotional health to help patients not only understand but also transform their relationship with illness. And listeners, let me tell you that this conversation is for anyone who has ever felt like the symptoms were all, quote unquote, all in their head, or for healthcare providers who want to see the whole human, not just the lab reports. So let's dive in and let's welcome Julius to the show. So, Julius, welcome. And as always, I'm really honored to have you here with us.
Well, thank you, son. I appreciate the invitation, and I'm honored as well.
Wonderful, wonderful. So, Julius, let's begin with the um, existing situation here. So, you have said that many symptoms they are classified as medically unexplained because Western medicine can't find any physical evidence for them. And, uh, I would say that that can really, really feel invalidating, kind of, frustrating for patients. So, why do you think the emotional or non physical dimensions are largely, still overlooked in the mainstream medicine?
It's a great question, and it's a curious thing for me as well, and because it seems so obvious to me. You know, I think we are, we have become, especially in the West, so physically focused.
Hmm.
And I think the reason for that, is back in the late 1800s, William Osler, who was considered sort of the father of Western medicine, modern Western medicine, said we have to follow the scientific principles in medicine, and we have to prove that, a technique works or what have you. And I think he was a very wise man. And I think if he knew what would have happened because of what he said, I think he would have been a little bit more careful in the way he said it. Because what's happened is we have, in following the scientific method, which of course I believe in, but there are issues with it. And the issues are that in when you're following the scientific method, you have to measure things. And so you're gonna
Yeah.
focus on things that are easier to measure. So, for instance, blood pressure, right? 100 years ago, not quite, yeah, about it maybe that long ago, we found we could measure blood pressure, and we found that people with really high blood pressure did worse than people with normal blood pressure. Okay, so that you measured it and
Hmm.
you saw that. And so then they developed drugs to lower blood pressure, and then they started testing these drugs, and if you lowered the blood pressure, people did better. And that's good. We can treat, we don't have the issues today that we had 100 years ago with, severe high blood pressure. And
Yeah.
but but the problem with that is now all of our studies tend to be done on the physical things that are easy to measure. So like blood pressure, cholesterol, blood sugar, things like that, right? Or things you can see on an X-ray. The problem with as I like to term them, the non-physical dimensions of health, and when I think of those, I think of them as sort of mental health, emotional health, behavioral health, social,
Mm.
cultural, even spiritual health, right? And so when you look
Yep.
at it, those are if you try to do, you look at psychosociologic studies, they're very difficult to do. It's very hard to measure things like emotions, depression,
Yeah.
anxiety, and things like this, right? And so I think that's one of the reasons that we have gotten stuck focusing on only the physical. Because if you go to see your doctor and you have headaches and he doesn't find anything, it's a little bit of a paradox. First of all, because one, you're happy that he didn't find anything, because if he finds something, it's bad. But on the other hand, like you said in your introduction, it's the fact that you
Mhm.
didn't find anything is kind of unnerving to the patient as well, because they think, believe I'm making these up, or whether it's in my head, or what have you. And so it's a bit
Yeah.
difficult. But then what do you do now? The doctor knows, oh, this is probably just related to stress. He may even tell you this is just stress, and then he gives you a bunch of pills to treat the headache and nothing to do nothing about the stress.
Yeah, I think that absolutely makes sense, and um, it's kind of uh, what we are what we have studied, or uh, what can be measured, what is tangible. That's the one only that we are referencing, and then making conclusions and diagnosis from there. So I think. It seems like we are training physicians to focus on test results, but not necessarily on the unseen aspects of suffering. And if that is considered, then it could be a huge, huge paradigm shift for the system as a whole.
Yeah, and I think, yes, I agree. And the other issue is treatment, right? And so it's,
Yeah.
again, that, as we have talked about before, right? The physician's toolbox is, for to fix things. You open up that toolbox, there's a tray. The first tray is procedures, surgeries, and things like that. If you don't need surgery, you take out that tray. The only thing left in the toolbox is pharmaceuticals. And
Mm.
so we start then, if your blood pressure is high, we give you a medicine to treat it. We don't treat the foundation, the cause of the blood pressure. We treat the blood pressure. If your
Yeah.
sugar is high, we give you a pill to treat the sugar. We don't treat the foundational issue causing the high blood sugar, right? And this is what Western medicine does in general, because to get at the foundational issues becomes problematic, or difficult or challenging. And so it's much easier. Someone who comes in with migraine headaches, I'm going to give you this pill to prevent migraines. I'm going to give you this other pill to treat migraines if you get one. And that's easy for the physician. He just writes a prescription. He doesn't have to spend time going through and trying to help you from an emotional sort of standpoint. And it's easy for the patient as well, because she or he doesn't have to change their lifestyle. They don't have to do anything different. They just have to take this pill in the morning, or two pills, or three pills, or five pills, and buy them every month and make the pharmaceutical companies, wealthy, because we're not curing anything, right?
Yeah.
All of those medicines, it's interesting, in Western medicine, outside of antibiotics can be curative, but outside of antibiotics, those medicines for chronic diseases don't cure anything.
I agree. I agree. I know that's the that particular aspect that you mentioned, like from the profits and
Mm.
um the wealth standpoint. I think this is something that deep down, at least the ones who are discussing about it, we all know about it, but we just don't want to accept it, for the fact we are also so much consumed by the busyness of our lives, that sometimes we forget that we are also a part of that entire kind of food chain.
Yes, absolutely, absolutely.
And Julius, now here, of course, uh, there will be skepticism. Um, and some people would argue here that focusing too much on the non physical, non measurable, or emotional, it will cause risk, dismissing real physical illnesses, or, delaying a much needed medical treatment. So, how do you respond to that criticism?
Was very important, right? So if someone comes in with some kind of symptom, whether it's headaches, or belly pain, or chest pain, or back pain, the first thing that you need. So if you came into my office as a cardiologist, I did see a lot of headaches and irritable bowels and belly pain, but most of what I saw is chest pain and palpitations and things like that. If you came
Mhm.
in, the first thing you got is a thorough, medical evaluation, because if you came in with chest pain, I wanted to make sure you weren't having a heart attack. I wanted to make sure you didn't have unstable angina. Even though those heart attacks and unstable angina and coronary disease may, I believe, have an emotional basis, but at the time, if you're having a heart attack, we're not going to deal with the emotional issue. We need to deal with the heart attack, right? If you have headaches and you have a brain tumor, yes, some emotional issue that we need to deal with, but that's going to be first we deal with the brain tumor, right? Same thing
Sure.
with the belly. If you've got Crohn's disease or appendicitis or something like that, we want to make sure that we first look at the physical and make sure that there are no physical issues that need to be dealt with, especially acute, but even sort of chronic things like autoimmune syndromes are very sort of common one. And so that's first. And then second, if you're having, let's say, migraine headaches, then being put on the medicine to prevent migraines or to treat the migraines is fine. I'm not saying not to do the medicine. But again, the medicine doesn't get to the foundational issues. Start the medicine so that you feel better and such. But the medicine can have side effects. You have to stay on it. It's not curative. But then, in addition, start to look at these emotional, behavioral, mental health kind of issues, social issues, and things like that, and address those while you're on the medicine. And it's just a more comprehensive. That's why I like to call it holistic health, right? It's a holistic approach to the patient's symptoms.
Mm, definitely, definitely. And I think that's I mean, what you said is basically the essence of having conversations through so many podcasts, especially on Healthy Mind by Avik platform also, that not only mental health, not only emotional health, but spiritual health, but it's a holistic approach towards talking about spreading awareness, around wellness of all of us humans. And of course, in sync with the nature, the cosmos around us as well, and the inside cosmos as well. So I think you really brought out the essence of what we are trying to do here. And
And, again, because we're so physically focused, we forget about these phenomenon that we know about in Western medicine. Like, we understand, for instance, the placebo effect,
Yep.
right? So you take a sugar pill and you get better. That it's acknowledged in medicine that that exists. Well, what is that about? That is nothing but mindset. This is a belief that this pill that you're getting, which is inert, but you believe is curative or helpful, right? And so we know that exists. In my mind, we need to figure out how to amplify the placebo effect, not think of it as a nuisance, because the pharmaceutical companies think it's a nuisance because they have to test their pill, their $500 million pill or $1 billion pill. They have to test it against the placebo and show that it works better, which means that the placebo works. And then in addition, we have these psychosocial kind of studies that are done on mindset and its effect on the physical and mental health aspects of a human being. So, for
Mm.
instance, I don't know if you're familiar, if your readers, listeners are familiar with a study that called the counterclockwise study that was published back in 1979. This was done
Mhm.
by Ellen Langer, who's a psychologist was at Harvard, and she
Okay.
did a study in 1979 where she took a bunch of men in their 70s and she took them to a monastery that was decorated like to look like 1959. So it looked like 20 years earlier. And
Okay.
and it everything they were immersed sort of like time like going back 20 years. So like they had vintage magazines and newspapers from 1959 that lined the tables. They had a black and white television. They were playing episodes of TV shows that played in 1959. They had photos on the walls of celebrities from the 1950s and and the radio was playing songs from the 1950s. There were no mirrors, there was no modern references, and the men were supposed to not just reminisce, they were instructed to live as if it was 1959, and they were there for I think it was a week or 10 days or something like that. And then before they went in, they did all of these psychological and, like, memory testing and things like that, and they did a bunch of physical measurements as well, strength, flexibility, mobility, and things like that. And in the
Mm.
time they were there, which again, I can't remember if it was a week or 10 days, but let's say it was 10 days. In that time, the people, when they came out and they repeated the measurements, the patients or the people's, their posture had improved, their joint
Mm.
flexibility had improved, they had enhanced memory and manual dexterity, their grip strength had improved, their hearing sharpened, their vision improved, their memory was better. They were physically stronger, and they came out basically physically younger. And they compared this to a control group where they brought them to the same monastery, but it didn't they were just reminiscing. They weren't, like, immersed in the 20 year
The
before, and they didn't have those kind of improvements. And so, again, that shows you, like, the power of the mindset, how strong these people actually got younger by, simply by putting them in an environment that looked like 20 years before. And so we forget about these studies are out there, and we don't emphasize them, or we don't think about how important the beliefs are and mindset and thoughts, how powerful a thought is,
Mm.
how it affects the body, both from a physical and mental health standpoint.
Absolutely, absolutely. I think this not at a very scientific level or from the perspective of aging, but this kind of affects, personally, I also feel when I, visit my parents. I'm in my childhood home, and I kind of reminisce everything,
Yeah.
the food, the songs, the moments, all the, early 90s times and everything.
Mhm.
So I I see some of the effects, physically on me and, mentally as well, that I'm generally happier in
Mhm.
comparison to how I am during my city days, or
Yeah.
when I am completely busy in my work and everything. Um, so
That's a
yes.
great yeah, that's the great example, and
Yep.
unfortunately, fortunately for you, it sounds like you had a wonderful childhood. The opposite is also true. If you go back and home and you had a miserable childhood, right? If you were, abused and things like that, that can have a very negative effect, right? As you
Yep.
carry these things with you, and people call them ghosts in the closet and things like that, but and that's a physical feeling, as you said, right? Uh,
Mhm,
yeah.
mhm. Yeah. And with this, I also bring in the element of gratitude. And I think that's one of the fundamental elements that we discussed in the previous podcast in your Gratefully Well model. And for someone struggling with chronic unexplained symptoms, Julius, what's the first practical step they can take to start integrating the non physical aspects of healing into their care?
Yeah, so let me just emphasize, just so we don't get criticized too much. So the first thing they need is a good, thorough medical evaluation to make sure that they don't have some kind of, a physical issue that needs to be taken care of. So that's first. But then,
Okay.
if they don't, then we start to address and get them to understand the importance, how mindset, how beliefs, how thoughts can cause these headaches, or how they can affect the body's physiology. And so we go through that to make sure that they have a good understanding that this is not in their head, that it's in their body, but there's nothing physical there that's causing it. I mean, it is physical. The symptoms are certainly physical, but it's due to these, you know, some kind of sometimes neuroscience, the neurotransmitters and hormones and things that get secreted, but then also the muscles tense, and the way when you're tense, you shrug your shoulders or you tighten your back, or and we certainly know how much stress can affect the belly, right? So getting them to understand that there is I like to, instead of using the word stress, I like to use emotional, that there is this emotional or behavioral component to their symptoms. So that's the second thing after the physical evaluation. And then
Mhm.
after that, then some tools to begin to reframe their situation. So now the other thing that's important, and this is critical, is they have to be willing to take some responsibility for their own health and healthcare. Right.
Yeah.
Again, the average American here, if, wants to go to the doctor, give me a pill so I don't have to change anything in my lifestyle, whatever. If you want to do that, this technique is not going to work for you. This technique,
Yeah.
you have to be willing to take responsibility for your own healthcare. That doesn't mean blame.
Yep.
Taking responsibility and blame are 2 different things, okay? So if you take some responsibility, so you say, "Okay, here's my situation. Where's the stress? Where's this emotional sort of issues? Is it at home? Is it with my husband? Is it with my kids? Is it with, work? Is it with my boss? Where is this?" And you have to begin to reframe that situation. So if it's, with your spouse, let's say, then you need to figure out to sit down with your spouse and say, "Hey, these are sort of the issues." And you start to do whatever you want to call it, whether you call it therapy or counseling. You start to develop techniques like cognitive behavioral therapy and things like that. And I use gratitude as I like to call it an instantaneous sort of reframing, right? So you can look at your spouse and yes, maybe he or she can be difficult at times, but there are positive things about it. And so rather than focus on those negatives, you try to find one thing, just one thing that, is positive about your spouse. Oh, well, at least he's not out, having affairs or things like that. Okay. So that's one thing that's positive, or he works and he brings home, a good salary. And you start to build on those. And so rather than sitting, you can sit with a journal and write 3 things down. But I always say, try to find one thing and then amplify that one thing. And once you find one thing, it's easy to find another. And you can do this, but it's a choice you have to make, right? It's as I think we talked about it before.
Yeah.
It's easier to choose the victim mindset where you blame your spouse or you blame your children or you blame your boss or you blame your company, right? And you because then you say, "I have these headaches, but it's not my fault." It's my
Mm.
spouse's fault, it's my kid's fault, it's my parents' fault, it's my company's fault, it's my boss, whatever. You blame them and that seems easier because you don't have to take responsibility. But that's a trap. That's an absolute trap because now it's out of your control. And if it's out of your control, there's nothing you can do about it. And that is incredibly stressful, right? When you look at stress components, when things are out of your control, those are the most stressful things. So if you bring things back into your control and you look at
Mhm.
things that you can do, so if you make a choice, I'm going to perceive this situation not as a victim, but as a victor or as a non-victim mindset, then you
Exactly.
can start to move forward from that. And it's amazing then the positive things, or I don't know how to call it positive. That's not the right word. The grateful things that you can find, the things that you can be grateful for, even at work, even in those stressful situations.
Exactly. The perspective changes, the intention, the way of looking at, those situations, those events, or the people around you. It changes. It drastically changes.
Yeah.
I
So
mean,
it goes back to that choice like we talked about before, right? You have a choice and it depends, what are you choosing? How are you choosing to perceive this?
absolutely. And before we wrap up, Julius, let's just reflect quickly as we have a time constraint here. I mean, do you think, Julius, that mainstream Western medicine will ever fully integrate the non-physical dimensions of health, or this will just, remain as more of a complementary or an alternative approach?
I'm optimistic. I have honestly seen what I would call progress over I graduated from medical school in 1986. So it's almost 40 years that I've been doing this. Uh,
Or
and, um, you know, I had early on when I saw these patients, I had stopped sending, I used to send patients to psychiatrists. And I stopped doing that because when I did that, all they got was medicine from the psychiatrist. They had 15-minute appointments. And I was like, Wait a minute, that's not what a psychiatrist is supposed to do." But today, even psychiatrists, but more counselors, we have developed other techniques besides medicine, things like cognitive behavioral therapy, dialectic behavioral therapy, uh,
Yeah.
emotional freedom techniques, all the thought field therapies, EMDR, all of these other techniques that we have developed, and so I see positive changes. Now, I personally believe, like, let's just take migraine headaches. That's what we've been talking about. I believe that that is, a mental health issue. Now, it maybe not a mental health disorder. Maybe it's not in the DSM-5 or whatever we're up to. But everyone I believe, with migraine headache should get medicines, and that's fine. But in addition, they should see a counselor or a therapist or a psychologist to work on that emotional, mental health, behavioral sort of issue as well. And I've seen that it's been slow and we don't value it so much and I know that because we don't pay the counselors as well as we pay surgeons as an example. But there's been positive changes and I'm very optimistic.
Yeah, I'm as well. I'm as well, and especially I think through conversations like this and through your work, Julius, this really makes me more and more optimistic. And finally, for our listeners, they would like to connect with you and explore more about the resources that you're providing and Gratefully Well framework. What will be the best way?
So I have a book that's available on Amazon and called Holistic Health Pathways that specifically is related to gratitude. That is the physical and mental health benefits of gratitude. It's called Holistic Health Pathways: Awaken Vitality and Resilience with Intentional Gratitude. Teach about a very specific form of gratitude I like to call the traceback method. In addition, I have a website called gratefully well.com. So the transformation I've trying to make from my practice to this digital online educational space, I call
Mm.
Gratefully Well. So there's a website called gratefully well.com. You can go there and take our 7-day gratitude challenge. We're developing a community of people who are like-minded individuals who are willing to take some responsibility for their healthcare, who are looking for these kind of resources and support. And so we're in the process of developing that community now. And I have a free newsletter that's on Substack.com called Gratefully Well. I encourage people to subscribe to that. And they that I write about these principles there and these techniques. And then there'll be announcements there. There'll probably be a podcast in the not yet, but we'll build in the community. There'll be announcements about support groups and about workshops that we're going to do in master classes in all of this as well.
That is awesome, Julius. I'll make sure to have all the details and links in the show notes. And thank you so much, Julius, for sharing decades of insight and compassion with us today. And I think this is such an enlightening conversation. And it's more about healing that isn't just about treating the body, but it's tending to the mind, emotions, and unseen part of ourselves that right now, today, Western medicine sometimes is overlooking. But as you said, and I'm also bullish, so let's hope for the best. And with this, we wrap up this episode of the Mindful Living. Listeners, just refer to the show notes to connect with Julius and keep listening to us, and be sure to subscribe to us so that you don't miss conversations like this. Until then, be kind to yourself, stay curious, and keep living mindfully. Thank you.